Hi, we're here at HIMSS 2017 in Orlando, Florida, and we're talking with Nandini Rangaswamy, Executive VP and Chief Strategy Officer at ZeOmega. Welcome.
Thank you. So I would say one of the main reasons you should be looking at dedicated PHM platforms is this notion of managing clinical and financial risk. EMR solutions, EMR platforms, even today, do not understand completely where that risk lies. Very often it is translated back to, how are we doing in terms of our services, did the patient use those services, whether it's a treatment plan, etc. But the real risk lies outside the clinic, outside the care setting, outside at the home. For example, the doctor could be prescribing a treatment plan that is conforming to evidence-based medicine, one of the best standards in the world, sends the patient out the door with costly medication, but the effectiveness of that care depends upon whether the patient takes that medication or not. Well, if they turn out to be, not as economically sound as financially sound as you would hope they can to afford the medication, they're not going to buy it. So if affordability is an issue, then that's driving the quality. So now begs the question, how are you going to find out some of these drivers which are completely non-clinical? These are all social determinants of health, psychosocial factors. How do you know what is that patient's tendency to stick to a treatment regimen? What are the factors he's falling off of that? What other support does he need? Does he need a caregiver support? Is there a lack of a PCP involved? Does this patient hop? It's those kinds of risk drivers that really drive the overall health and well-being. We know that 80% of the health outcomes are driven by non-clinical factors. And that's where dedicated PHM platforms are really shining, in the sense that these platforms are able to get into the patient's environment, surroundings, and make an assessment of what is the biggest need for the hour. Well, if there is a medication prescription and we have seen that not being filled, we can have a care coordinator reach out and talk to the patient about lower, less expensive sources of medications. Or for example, if they're in a post-surgical recovery situation and they don't have a caregiver at home, the care coordinators can then make sure there is some temporary caregiving support available. It's those kinds of issues that really bring down the risk profile of the patient and improve the overall health. And that's where dedicated PHM platforms shine, because they have the data, they have the analytics horsepower to drive these kinds of activities in real time, and they're able to measure the impact of those activities and tell the organization this is how they're doing on their PHM program.